Indeed, the world over, countries have adopted the mantra, test, isolate, treat, trace. Kenya has adopted this mantra. With regard to testing, the Pharmacy and Poisons Board is now accelerating regulatory decisions regarding approval of COVID test kits. The board is implementing stringent, expedited accreditation mechanism, which has shrunk the process from 3 months to 48 hours. Using this approach, the board has authorized the employment of 4 test kits for detecting the virus, which are currently being used. And these include Copper SARS-CoV-2 test kit by Roche Diagnostics, Expert Express SARS-CoV-2 by Cepheid, BioFire COVID-19 test by BioFire Defense LLC, Abbott by Abbott Molecular Inc. With this approach, our capacity for testing will be expanded from our current 10 to cover at least 1 laboratory in each county. This is expected to take place in the next 2 weeks. We request that incoming applications are uploaded along with the requisite documents to the PPB portal. As shared in the past briefings, the current phase involves deployment of targeted testing with a focus on frontline healthcare workers, identified hotspots and clusters in Nairobi, Mombasa, enhancing community-based surveillance and screening trunk transit drivers. With regard to isolation and quarantine, we have 33 quarantine centers that are currently active. We have closed down a good number of sites. At the moment, we have 483 individuals in the various centers across the country. We have also quarantined 455 other persons for defying national curfew regulations. And I think this is important to note, because once you are out during curfew hours, it is assumed that you have now been exposed, and therefore, if you are taken, you will be taken to a quarantine site for 14 days at your own cost. We are today launching a special designated isolation and treatment facility for our healthcare workers. This facility will be able to offer both critical care, basic care services for our healthcare workers. All costs incurred during treatment shall be met by the government. With regards to tracing, 11 more persons have tested positive for the disease today, bringing the total to 281 in the country. Of these confirmed cases, 7 are Kenyans from Mombasa. And in that Mombasa area, we have got quite a few, I think 3 are from Bondeni in the old town in Mombasa. We have a few also from other areas, Miritini. I think we have a case from Miritini, and a couple of other areas within Mombasa town itself. The other 4 are from Nairobi, and those ones are from Ruaka. The Ruaka area is where we got those 4. And none of those have a recent travel history as such. And 5 are female, while 6 are male. 7 of those are from our quarantine centers, the ones in Mombasa in our quarantine centers. and 4 were picked by a surveillance team from various parts of the country. They are aged between 11 and 80 years old. And I can confirm that the herbalist who died in Mombasa, Old Town, the 3 in that area, in the Old Town, are actually contacts of the herbalist who died in the same area. And there goes the whole idea, and why we are always talking about keeping distance. That's why we are always talking about people going around and not taking care and not wearing masks. These are some of the results that we are getting as a result of these shortfalls. We are also happy that 2 patients have recovered and been discharged. And out of those 2 patients, I can also report that one of them is a doctor. We have 2 doctors who had tested positive, and one doctor is still under treatment, while the other one has recovered. So we now have a total of 69 recoveries. The number of people we have lost remains at 14. I also want to make a special appeal to people in the counties of Machakos, Kajiado, Kiambu, and Murang'a. As Nairobi metropolitan counties, you have a special responsibility to guard against the spread of coronavirus from Nairobi County. Already, a number of your residents have contracted the virus, and we have isolated them for treatment. In Machakos, for instance, we have 7 cases. 1 from Soikimau, 1 from 2 from Siokimau, and there is 1 each in Athi River, Kamulu. We have a case now from Kamulu, Ruby Garden Estate. We have a case from Kidunguni and Viranji. In Kiambu, we have a case each of the following estates. Githurai has a case, Githurai 45, Dongoru, Edegua, Tinganga, Waidaka, and Wataalam. Kajiado 2, we have cases in Kitengela, in Matasia, and Ongata Rongai. In Murang'a, we have 2 cases in Gatanga and Lumumba Drive. All these cases are being treated in our various hospitals, and we hope and pray that they will soon be cured. But the reason for mentioning the specific areas is to establish and to show you that it is not a Nairobi disease, it is not a stranger's disease, it is something in your neighborhood. It is something that is being carried by a brother, a sister. It is something that is within a friend that you have, and therefore it is just to emphasize the need for social distancing and the need to be just careful as we move along.
That you have tested in the last 24 hours and cumulatively, as well as
from maybe Dr. Amoth, last time you did
yes.
No, but you're getting the news on Zoom.
Yes.
social distance in place.
Yes.
Good. Thank you, I'm Rev. Thank you,